Cita Medica. Thank you so much for being with us.
My pleasure to be with you this morning.
Thank you very, very much. So let's start by explaining, Dr. DeFronso, what is type 2 diabetes and what's the difference between type 2 diabetes and type 1 diabetes?
Good, an important question. Type 2 diabetes is a disease that usually comes on later in life, and it's characterized by two major problems. Number one, people don't secrete enough insulin. And of course, insulin is the major hormone that regulates how our body utilizes glucose, amino acids, and lipids. And it is also characterized by resistance to the effect of insulin. So type 2 diabetics have two major problems. They don't secrete enough insulin, and they don't respond to the insulin that they secrete sufficiently. And it comes on later in life. Type 1 diabetes, a totally different disease. It's what we call an autoimmune disease. And for reasons that are still unclear, your body decides that your pancreas, and particularly the beta cells, which are the cells that secrete insulin, don't belong to you. So they launch an attack and they destroy your beta cells. And the end result is you end up with a deficiency, actually no insulin whatsoever. These people who have type 1 diabetes are going to require insulin, and it's much more common to see type 1 diabetes in children, and they require insulin for the rest of their life. Whereas people with type 2 diabetes, we treat with diet and exercise, in particular to lose weight. And we have a number of medications that can be taken orally or by injection to help patients become more sensitive to insulin and to secrete more insulin.
Dr. DeFronso, before starting to talk about the treatments available and what is the new treatment regarding type 2 diabetes, please let us know what are the symptoms of type 2 diabetes and what are the consequences of this disease if it is not controlled?
Yeah, very important question for people. Now, unfortunately, in the majority of patients, there are no symptoms. People have diabetes for 5 or 10 years before they develop symptoms or are found out by accident, may on a routine medical examination, or they may get in a car accident, they come to the hospital, and then they're found to have a very high glucose. But when people do present with symptoms, it's very common blurred vision. They oftentimes will find pins and needle sensations in their fingertips or in their lower extremities, in the feet. But I would say the most common symptom is actually fatigue, tiredness. You know, I work 10, 12 hours every day. At the end of the day, I'm pretty tired. So unfortunately, lack of symptoms or really nondescript symptoms such as tiredness, fatigue, etc., there. But that's not really what gets people to come to see the doctor. When they get blurred vision, of course, that gets them nervous. When they start to get these paresthesias and numbness in their hand and their feet, they start, to say, well, maybe I should go see my doctor. Now, unfortunately, or maybe fortunately, if we pick people up early enough because they have these symptoms, we can treat them and prevent the symptoms from progressing. Unfortunately, many people go on for a long period of time, and there's a lot of damage that's done to the eyes, a lot of damage that's done to the kidney, a lot of damage that's done to the nerve in the feet. So when people step on a pin or a nail, they don't realize that they've actually stepped on it, and they get an ulceration that may lead to amputation. And then many people have extensive changes in the arteries perfusing the heart. So they present with a heart attack, or in the arteries that go to the brain and they present with a stroke. So a lot of these changes can be really quite profound and extensive long before people get any symptoms. And that's really one of the big problems that we have.
Thank you, Dr. DeFronso. We're going to make a pause and keep doing this TV show. Vamos a hacer una breve pausa y regresamos con el Dr. DeFronso para hablar acerca de el tratamiento de la diabetes tipo 2 y de los nuevos medicamentos en este sentido. Hacemos una pausa. Regresamos.
deportivo, opiniones que generan controversia.
Yo creo que aquí la historia puede ser diferente.
Desempeños y resultados, los deportes.
Ganas, la enjundia, las contrataciones, desde directivos hasta jugadores, está el equipo completo.
Análisis a detalle, solo con nuestros expertos. Lunes a viernes a las 4 de la tarde.
PIB, que pertenece al cubano, que recordarás que ese título se lo quitaron.
Por Canal 12, Televisa California. Nos acerca.
¡Nada más!
Prepárense para una película de héroes, villanos, traición, venganza, comedia, amor.
¿Te quieres casar conmigo?
Y guerra. Una película de amor y guerra.
¿Preguntas?
2 de octubre, solo en cines.
Celebra la cultura, la tradición y la comunidad. Mission Fed Credit Union te regala una edición especial de la lotería hecha para San Diego. Visita una de sus 34 sucursales y pide la tuya. Mission Fed, celebrando nuestra cultura y tu futuro.
Los incendios forestales pueden arriesgar nuestro estilo de vida. Por eso, SDG&E invierte tanto en la prevención de los incendios, porque creemos que cuando puedes ayudar, lo haces.
Es Octubre en tu concesionario Toyota con un gran inventario de camionetas nuevas. Arrienda una Tacoma nueva por $199 al mes o un bajo APR de 2.99. Lo hacemos fácil. Toyota, vayamos juntos.
Una historia aspiracional.
Ceci contigo. Ella tiene el plan ideal para pasarla genial.
Quiero que sepa que yo lo admiro mucho.
Siempre a tiempo.
El gallito con betón.
Siempre en confianza.
Que cuando yo me separé,
siempre contigo.
Que una tonta que se muere sin tus besos.
Ceci contigo. Conoce todos los secretos de tus artistas favoritos. Todos los sábados por Canal 12. Televisa California. Nos acerca.
Gracias por continuar con nosotros en mi cita médica. Estamos conversando con el doctor Ralph DeFronzo. Él es endocrinólogo y nefrólogo. Y vamos a platicar acerca del tratamiento de la diabetes tipo 2. Dr. DeFronzo, please tell us what is the treatment? How do you manage a patient with type 2 diabetes? And what is new regarding the treatment of this disease?
A very important question. Up until 1995, our treatment options were really pretty limited. In the United States, and this is pretty much true everywhere in the world, we had insulin and we had a class of drugs called sulfonylureas. In 1995, I brought to the United States a new drug called metformin. Now, metformin had been present in many other countries, but for reasons that are unique to the United States, metformin was not available here. So this was a revolution in 1995. But I have to say, since 1995, we've really seen an explosion of new medications for the treatment of type 2 diabetes. So now we have many, many options and many better options. So we had a class of drugs called DPP-4 inhibitors, dipeptidopeptidase 4 inhibitors. And these drugs allow our body to make a what we call an incretin hormone called GLP-1 increase. And we know that in people with diabetes, the ability of GLP-1, which is secreted by our gastrointestinal tract, the ability of this GLP-1 to stimulate insulin is impaired. So the DPP-4 inhibitors were, I think, an important breakthrough. But even more importantly now, we have a whole new class of what we call GLP-1, glucagon-like peptide-1 drugs, which are very, very powerful in secreting insulin. And equally important, these drugs are very, very powerful in promoting weight loss. And we know that one of the major problems that we have to deal with in people who are obese is that they are very, very insulin resistant. And when you lose weight, this improves how the body responds to insulin. So these GLP-1 analogs are very effective because they increase directly insulin secretion, and then indirectly by promoting weight loss, they improve insulin sensitivity. We also have a new class of drugs, which I actually invented, called the SGLT2 inhibitors. Unfortunately for me, I didn't patent this class of drugs, but I did invent them and played a very important role in bringing them to the market. So what are the SGLT2 inhibitor drugs and how do they work? So every day, our kidneys filter a very large amount of glucose. But in the early part of the tubules in the kidney, we reabsorb all of that glucose, and no glucose appears in the urine. Now, in that early part of the kidney, there's a transporter called the SGLT2 transporter. S for sodium, GL for glucose, T for transporter. And that transporter reabsorbs about 90% of the glucose that's filtered by the kidney. So what goes wrong in people with type 2 diabetes? There's an increased expression, an increase in the amount, the number of those SGLT2 inhibitors. So although the diabetic has a high glucose and the kidney filters a lot of the glucose, the overactivity of the SGLT2 transporter results in increased reabsorption. So in the diabetic, what we want is the kidney to dump the glucose in the urine. But very paradoxically, in the diabetic kidney, it's very, very zealous in reabsorbing the glucose. And in fact, the higher and the worse is the glucose control in a diabetic, the more avidly does the kidney reabsorb that glucose. So this new class of drugs, the SGLT2 inhibitors, blocks the ability of the kidney to reabsorb the glucose. And although this sounds very simple, when I invented this class of drugs, it wasn't so simple. We just allowed the kidney to excrete the glucose in the urine.
Vamos a hacer una pausa y regresamos para hablar más acerca de esta nueva familia de medicamentos para tratar la diabetes tipo 2. Volvemos.
¿Qué tal, amigos? ¡Qué gusto!
Historias y personajes que nos inspiran, pláticas amenas, cercana y con el corazón abierto.
Tú eres el mejor, tú eres la mejor en esto, eres extraordinaria.
Testimonios que vienen del alma, desarrollo humano y conciencia plena, cercanía, entrega y plenitud. Esto es Más que Palabras, conducido por Vivi Uribe, lunes a viernes, 1 de la tarde, por Canal 12, Televisa Californias, nos acerca.
¡Qué satisfacción tan grande ha sido el poder ayudarle! En Yvonne Welch Medicare Plans, hace tiempo decidimos servir a nuestra comunidad de adultos mayores, o mejor dicho, a nuestros seres queridos. Y gracias a eso, cientos de familias han sido beneficiadas. En realidad, para nosotros ha sido un gran privilegio llevar la información que puede cambiar sus vidas y así disfrutar de sus años dorados. Lo guiamos en el proceso con su plan de Medicare, asegurándonos que reciban la cobertura que necesitan y los beneficios que se merecen. Por eso, llámanos ahora y entérate de los nuevos cambios que vienen con los planes de Medicare. El equipo de Yvonne Welch Medicare Plans atenderá tu llamada cordialmente y en tu idioma, dedicando el tiempo necesario para ayudarte con lo que más te importa. Recuerda, nuestros servicios no tienen ningún costo. Llámanos, no pierdas la cobertura y beneficios que necesitas y mereces por falta de información.
Llama al 619-383-3434.
¿Qué tal? Bienvenidos a las noticias, soy César García.
Yo soy Isla Sánchez e iniciamos con la información.
Comienza tu día con una taza de café y la mejor compañía.
En un momento más regreso con todos ustedes allá en Mexicali, Tijuana y Ensenada.
Las noticias al amanecer te acompaña con la información más relevante.
La basura parece acumulada tanto en terrenos baldíos como en la vía pública.
Análisis a profundidad y temas de interés para la comunidad.
Recuerde que usted también puede ser el reportero ciudadano.
De lunes a viernes en punto de las 6 de la mañana por Canal 12.
Gracias por continuar con nosotros en Mi Cita Médica. Seguimos conversando con el doctor Ralph DeFronzo. Nos sentimos muy honrados en Mi Cita Médica de tenerlo. Él es el inventor de esta nueva clase de medicamentos para tratar la diabetes tipo 2, que son los inhibidores de la sodio-glucosa cotransportador 2. Los inhibidores del sodio-glucosa cotransportador 2, que son SGLT2. SGLT2 por sus siglas en inglés, esta nueva familia de medicamentos para tratar la diabetes tipo 2, que lo que hace, como lo acaba de explicar el doctor De Fronzo, es reducir los niveles de glucosa en el cuerpo, que finalmente estos niveles altos de glucosa en el cuerpo, los niveles altos de azúcar, son los que ocasionan el daño vascular, que genera los infartos, que genera la ceguera, que genera la insuficiencia renal, que lleva a un trasplante de riñón. Entonces, bueno, doctor De Fronzo, we keep talking about this family of drugs that you discovered, the SGLT2 inhibitor category of medications. How do you give these medications? Because you say that you like to give the combination of the GLP-1 agonists with this family of drugs together. We know that GLP-1 agonists are injected. And how do you give the SGLT2 inhibitors?
Yeah, the SGLT2 inhibitors are very easy to give. They're given as a tablet. You have to take them once a day, so that when the patient gets up in the morning or when they go to bed at night, they can take the SGLT2 inhibitor tablet with any of their other medications. Now, the GLP-1 receptor agonists, the really potent ones, are given by subcutaneous injection once a week. They also have a preparation that can be given orally now. We have some newer GLP-1 receptor agonists. So patients do have a choice of taking the oral GLP-1 or the injectable. For the SGLT2 inhibitors, they're all given in tablet form, and they're taken once a day. And the side effect profile is really quite good. In women, we may see a small increase in mycotic vaginal infections. And in males who are not circumcised, there's also a small increase in the incidence of penile mycotic infection. As I said, these infections are relatively uncommon, easily treated with a vaginal or a cream that's applied to the skin. And other than really this side effect, which is, as I said, relatively uncommon, the side effect profile really is quite small. Very easy for patients to tolerate, and as I said, very effective in lowering the glucose, and very effective. We have many, many studies now showing they give you heart protection and kidney protection as well.
And Dr. De Fronzo, for how long do people with type 2 diabetes need to take this medication? I mean, we know that there is not a cure so far for type 2 diabetes. So what's so far, how long have you given these medications to the patients?
Yeah, unfortunately, diabetes is something you have to live with in your entire life. You inherit a set of genes from your mom and your dad, and obviously you can't get rid of those genes that predispose you to diabetes. But you can help in a big way by maintaining ideal body weight. We know that people who gain weight, when you gain weight, your tissues become very resistant to insulin. So maintaining your ideal body weight is very, very important. Also important to exercise as frequently as possible. Now, one of the major benefits of the SGLT2 inhibitors is they also promote weight loss. So obviously, if I block the kidney's reabsorption of glucose and you lose that glucose in the urine, you're losing calories in the urine. And so we know that after about 6 months, people lose 2.5 to 3 kilograms. That's about 6 to 8 pounds. And that is another, I say, beneficial side effect, so to speak, a very good side effect of this class of drugs. And if people do have a heart problem, these drugs also improve how your heart functions. And so that allows people to do more exercise as well. So the lifestyle interventions that we like people to do in terms of losing weight and exercise, the SGLT2 inhibitors can be very helpful in our diabetic patients.
Dr. De Fronzo, we're going to make a pause and we go for our last block.
Okay.
Hacemos una pausa y regresamos con nuestro último bloque acerca de este programa dedicado al tratamiento de la diabetes tipo 2. Continuamos.
Nuestra pasión esta es Perséfone.
Momento de tensión, adrenalina sin control, lo extremo del deporte y la emoción de conocer los resultados.
¿A quién se le ocurrió esto? Y vean qué gol hizo.
Acción, todos los domingos a las 2 de la tarde.
Aquí Chicharito quería escapar. Chicharito disparaba, pero corta.
Cuérdate, ahora sí le dio una dosis a bronca. Izquierda por arriba.
Por Canal 12, Televisa California, nos acerca.
California nos importa mucho, pero nos importan mucho más los californianos como tú, que con el sudor de tu frente aportas a la vida diaria del estado. Por eso mereces cuidado de salud de calidad, sin tener que elegir entre tu salud o pagar la renta. Aquí negociamos por ti y eliminamos la confusión. No somos una compañía de seguro médico. Somos californianos como tú. Covered California.
San Diego, vámonos a Tijuanita. No se creas. No se creas. Somos el bueno, la mala y el feo. Y aquí les tenemos todo lo que se necesita para cuando vaya a chambear y vaya manejando, pues no se aburran.
¡Claro! ¡Están escuchando La Trampa! La Enchufada, El Hacker y los Pausa Tips.
Además también la mejor música. San Diego, solamente aquí en nuestra casa. La Qué Buena 106.5 todas las mañanas. El bueno, la mala y el feo.
¡Puro show!
Las noticias que te interesan contadas como tú quieres.
¡Nos quedaron cortos!
Desde las noticias que afectan a tu comunidad hasta las historias que te hacen sonreír.
Mexicali,
Ensenada, Tijuana,
California.
todo lo que pasa a tu alrededor.
Gracias por continuar con nosotros en Mi Cita Médica. Estamos conversando con el doctor Ralph DeFronzo, endocrinólogo y nefrólogo, inventor de esta nueva categoría de medicamentos, los SGLT2 inhibidores de SGLT2. Así que me da muchísimo gusto conversar con el doctor DeFronzo. Thank you so much for being with us in Mi Cita Médica. Tell us, please, about this new category of medications, the SGLT2 inhibitors. You already told us that it's a tablet that you take once a day, and it even helps you to lose weight and to lower your glucose levels. And what about the cost? Where is this family of drugs available in the world? Tell us a little bit more about the patient experience.
Yeah. So cost is always a very, very important issue. And we as docs, we know what are the good drugs. In my opinion, I like SGLT2 inhibitors for all the reasons we talked about. I like the GLP-1 receptor agonist. But these drugs also are not available to many of our patients, particularly who have a lower income. So let me just make a few comments about the GLP-1 receptor agonist. So they've been around for a long time. And the first generation ones are reasonably affordable. But the newer generation ones, like Ozempic and Mounjaro, are really quite expensive. They're $1,000 a month. So if you don't have insurance, and even with insurance, the copay can be quite expensive, these newer GLP-1 receptor agonists really are not readily available to many of our patients. Now, SGLT2 inhibitors have also been around for a long time. But until they go off patent, the cost of these drugs are not going to drop enormously. And if people have to pay for them out of pocket, it can be quite expensive, $500 to $600 per day. If you have insurance, of course, the copay can be affordable for many of our patients, can be in the range of $25 to $50. So if you have insurance and a good insurance and a good copay, reasonably, most of our patients who have the insurance can afford it. But if you don't have insurance and you have to pay for the drug, that's a big expense. There is a class, within this class of SGLT2 inhibitors, one called bexicagliflozin, Brenzavvy, which has a price of $50, can be a little bit less. If you don't have insurance, the price is still $50. Or I said sometimes you can get it for a little bit less. So again, this is a drug in people who don't have insurance that with this kind of cost, many of our patients can afford it. But we also know that there are people who, even for people who have no insurance, $50 a month can be expensive. But if you talk to the people, the company Theracos, who makes the Brenzavvy, you can also negotiate a lower price. So I think this is very important for our diabetic patients to realize because it really is designed for people who have trouble meeting who don't have insurance and have trouble actually paying for drugs, which are really life-saving. They save our heart, they save our kidney, they save our eyes. So I encourage people to explore this possibility of talking to Theracos and seeing if they can actually purchase the Brenzavvy from them.
And Dr. DeFronso, this medication is available in other countries other than the United States?
Yes, SGLT2s are available really throughout the world now. They're recognized as sort of one of the top class drugs. So yes, they are available pretty much everywhere in the world. And that is very important.
Dr. DeFronso, thank you so much. Thank you so much for discovering this family of drugs and inventing this family of drugs and helping people, helping the patients with type 2 diabetes. Thank you very much for your time for this interview. We are very grateful and very honored to have had you in the program.
Well, it's my great pleasure to be able to do this with you because diabetes untreated can be a devastating disease. But we have very, very good treatments. Doctors need to know about these treatments. Patients need to know about the treatment. And importantly, patients need to be able to afford the medications because we can prevent a lot of the complications. And that's really what we want to achieve here.
Thank you so much. Thank you so much for your time and knowledge. Bueno, pues así es como llegamos al final de este espacio. A nombre de todo el equipo que hace posible la realización de mi cita médica, a mis compañeros en la cabina, a mis compañeros en el foro de Televisa Californias, agradezco el favor de su atención y nos vemos la próxima.